About 70% of American adults have obesity or overweight. Having obesity or overweight is a serious health issue associated with some leading causes of death, including heart disease, stroke, and diabetes, and is linked to increased risk of certain types of cancer. Losing 5 to 10% of body weight has been associated with a decreased risk of cardiovascular disease in adult patients with obesity or overweight. Although diet and exercise are essential, I'll go over weight loss pharmacology and my recommendation. Let's start with Phentermine. Brand name is Adipex. It promotes weight loss by increasing norepinephrine in hypothalamic nuclei, leading to a decrease in food intake. It also acts as an adrenergic agonist that increases energy expenditure. In a 36-week controlled randomized trial, Phentermine group lost 13% of their initial weight, while the placebo group lost only 5%. Next medication is diethylpropion. Brand name is Tenuate, another sympathomimetic and derivative of bupropion. It acts through modulation of norepinephrine action. A 6-month double-blinded placebo-controlled randomized trials demonstrated diethylpropion resulted in average weight loss of 9.8% at 6 months versus 3.2% with placebo. Phentermine, diethylpropion, and other stimulants' main side effects are related to their sympathomimetic properties, including elevation in blood pressure and pulse, insomnia, constipation, and dry mouth. The controlled release single tablet combination of Phentermine plus topiramate, brand name Qsymia, was approved by FDA in 2012 for obesity. Topiramate is used for epilepsy and migraine prophylaxis that also suppresses appetite through modulation of GABA receptors. It also increased dopamine release. A 52-week randomized trial found 6.6% and 8.6% placebo-subtracted weight loss in the mid and maximum dose, respectively. The combination tablet of bupropion and naltrexone, brand name Contrave, was FDA approved for weight loss in 2014. Bupropion, brand name Wellbutrin or Zyban, is used for depression and smoking cessation and also can cause weight loss by promoting activation of central melanocortin pathway, which is involved in regulation of energy homeostasis. While the mean weight loss of just bupropion is small, it is the preferred antidepressant compared to some other antidepressants that cause weight gain. Naltrexone, part of the combo, is an opioid receptor antagonist approved for treatment of alcoholism and opioid addiction. The hypothalamic melanocortin and reward system contain opioid neurons, so naltrexone activity may influence food intake. Orlistat, brand name Xenical, promotes weight loss by inhibiting gastrointestinal lipases, thereby decreasing the absorption of fat from gastrointestinal tract. On average, 120 mg of Orlistat taken 3 times a day will decrease fat absorption by 30%. Orlistat at lower dose of 60 mg, trade name Ali, is approved for over-the-counter use. Lorcaserin, brand name Belviq, reduces appetite by activation of serotonin receptor in hypothalamus that controls appetite. Liraglutide, brand name Saxenda, was approved by FDA in 2014 for obesity. Liraglutide is a GLP-1 analog. GLP-1 is the appetite hormone, so Saxenda suppresses appetite significantly. The next one is from same class and is my favorite. It is Semaglutide. Just like Liraglutide, it works by mimicking GLP-1 hormone that targets area of the brain that regulate appetite and food intake. Semaglutide 1 mg once weekly injection, brand name Ozempic, was first approved as a treatment for type 2 diabetes in 2017. Feinberg School of Medicine in the US reported that results from a clinical trial of type 2 diabetes drug was linked to a sustained clinically relevant weight reduction in participants. Then FDA approved Wegovy, brand name, for 2.4 mg once weekly injection of semaglutide for chronic weight management. A placebo-controlled trial showed that people who received Wegovy lost an average of 14.9% of their initial body weight during a 68-week trial. Per my experience with health insurances, many of them want patients to try Metformin first and then Ozempic before approving Wegovy, as it costs about $1,400 monthly before insurance. Now I'll go over some of off-label medications for weight loss. As I mentioned in my anti-aging video, Metformin is a miracle drug. It is a diabetes medication and acts by suppressing gluconeogenesis and increasing peripheral insulin sensitivity. Potential weight loss mechanism of action includes activation of AMP-activated protein kinase to mimic an energy deficit state, increasing anoxygenic hormones GLP-1, growth factor 15, neuropeptide Y, and agouti-related protein, and increasing leptin sensitivity. The ECA stack is a drug combination used in weight loss which was popular through 1990s and early 2000s. ECA is an initialism for ephedrine, caffeine, and aspirin. A meta-analysis combining results from all available studies estimated average weight loss of 1 kilogram per month more than placebo. Clenbuterol is a drug that belongs to beta-2 agonist class. Drugs in this class cause airway in lungs to open up. Beta-2 agonists are often used to treat asthma. In addition to being used to treat asthma, Clenbuterol became popular as weight loss supplement, especially among athletes and Hollywood, because of its effect on fat reduction. FDA has not approved Clenbuterol for human use. If I was obese, I would go for Metformin and Wegovy. And that wraps up the weight loss pharmacology. Feel free to ask your weight loss questions in the comments.